Welcome to the educational series by Prospera Global on medical second opinion driving clinical accuracy and cost optimization. Question 4. From a clinical perspective, how do you differentiate between cases that truly require spinal surgery and those that can still be managed conservatively? Also, in your experience, how often is surgery recommended prematurely? What key symptoms or red flags should patients look for to know when surgery is genuinely necessary and when they should seek a second opinion?
So, with your questions, there are three parts in this. How I perceive it, the one thing. Second thing is like how the early surgeries are like which can be postponed. That's the second thing, and how I look into things, that also I'll be answering. So there are three parts in your question. So as such, like a true surgical necessity should be symptom driven, not based directly on imaging. Okay. So a doctor who is going to treat the patient should examine, he should mention his clinical findings, and you need to correlate that with the MRI findings. Okay, so sometimes the patients will have an arterial disease which will really be like a claudication related to a neurological condition as well. So whether those things they are really evaluated or not, there needs to be this one. So I see so many patients where they come with an MRI, but they all say that they have been advised for a surgery, but really I'm looking at the MRI as well as looking at the patient's clinical conditions most of the time, which can be avoided. That's what my experience is. Always we need to follow the comprehensive clinical assessment wherever I see those patients who have been advised surgery. So the clinical assessment charts or necessities are not done properly. Okay, so they just suggest that they have been having some disc problem and they require surgery, but what are their findings in those scenarios? They are not mentioned in any of their case sheets or follow-ups. So that's one thing that I have been this one. Most of the time, the role of conservative management will never be given an option to the patients. Okay, so that's one of the things I commonly come across. So the moment they say that a disc problem is there or a minor disc is there, all of them have been advised surgery, but which is not essentially true in real life. So I treat my patients, I always give them the first option as conservative management. If still they find that okay, what I am telling is little odd from what the previous doctor has told, I tell them you go back to any surgeon who operates the spine on daily basis. Okay, not a regular orthopedician or a regular neurosurgeon who operates spine once in a while or who calls someone else to operate for him. So these scenarios commonly happen. So they are not the good clinical judges. They see an MRI with something and they ask the patient to come for a surgery directly, but they will not be operating. So hence most of the time clinical decision making should be based on the symptoms. So it should be symptom driven decision that we needs to be doing that.
We hope this insightful session has enhanced your understanding of medical second opinions and addressed any doubts you may have had. Thank you for being part of our Medical Second Opinion educational series. If you found this helpful, please like, share, and subscribe.